The COVID-19 pandemic has cast a long shadow over our world. While the immediate threat of the virus seems to be receding, a new concern is emerging: the long-term impact on heart health, especially among young people. Recent data has revealed a disturbing trend of increased heart attacks and other cardiovascular issues in individuals who have contracted COVID-19, even those who experienced mild or asymptomatic infections. This hidden danger of the virus is raising alarm bells in the medical community, urging us to understand the link between COVID-19 and heart health. We've all heard about the respiratory complications of COVID-19, but the virus's impact on the cardiovascular system is equally concerning. Inflammation, a natural response to infection, seems to be the key player in this complex interplay. While inflammation helps our bodies fight off the virus, excessive or prolonged inflammation can damage the heart and blood vessels. This damage can manifest in various ways, from myocarditis, which is inflammation of the heart muscle, to blood clots and arrhythmias, or irregular heartbeats. The most alarming aspect of this emerging health crisis is its impact on young adults, a demographic typically considered low risk for heart problems. Before the pandemic, heart attacks in young people were relatively rare. However, recent studies suggest that COVID-19 might be changing this, increasing the risk of cardiovascular complications, even in individuals without any pre-existing heart conditions. This alarming trend underscores the need for increased awareness, early detection, and proactive measures to mitigate the long-term cardiovascular risks associated with COVID-19. The pandemic's long-term effects on heart health are still unfolding, but one thing is clear: COVID-19 is not just a respiratory illness. It's a multi-system disease that can have lasting consequences, particularly for the cardiovascular system. Understanding this connection is crucial to protecting ourselves and future generations from the silent threat of COVID-19-related heart disease. A landmark study published in Nature Medicine has provided compelling evidence linking COVID-19 to an increased risk of heart attacks, strokes, and other cardiovascular problems. The study, which analyzed the health records of over 150,000 veterans who had contracted COVID-19, found that even individuals who experienced mild or asymptomatic infections had a significantly higher risk of developing cardiovascular complications within a year of their diagnosis. The researchers discovered a staggering increase in heart attack risk among those who had contracted COVID-19 compared to those who had not. The study revealed that individuals who had been infected with the virus were 55% more likely to suffer a major adverse cardiovascular event, including heart attack, stroke, or death from cardiovascular disease. These findings remained consistent even after adjusting for other risk factors like age, sex, and pre-existing health conditions. This groundbreaking research has far-reaching implications for public health, especially considering the sheer number of people who have been infected with COVID-19 globally. The study's findings highlight the urgent need for increased surveillance of cardiovascular health in individuals who have recovered from COVID-19, even those who experienced mild cases. Early detection and intervention are crucial to preventing and managing potential heart problems. The study's authors emphasize that these findings should serve as a wake-up call for healthcare providers and the public alike. We can no longer view COVID-19 solely as a respiratory illness. Its impact on the cardiovascular system is undeniable and demands our attention. The medical community must prioritize research to understand the long-term effects of COVID-19 on the heart and develop effective strategies for prevention and treatment. Dr. Zand van Tulleken, a renowned physician and television presenter known for his work on health documentaries, experienced the hidden dangers of COVID-19 firsthand. Despite being young, fit, and with no prior history of heart problems, Dr. van Tulleken developed myocarditis, inflammation of the heart muscle, after contracting COVID-19. His story serves as a stark reminder that the virus can affect anyone, regardless of age or health status. Dr. van Tulleken's experience began with mild COVID-19 symptoms, including fatigue, cough, and loss of taste and smell. However, weeks after his initial infection, he started experiencing chest pain, shortness of breath, and heart palpitations. Concerned about his symptoms, Dr. van Tulleken underwent a series of tests, including an electrocardiogram, or ECG, and an echocardiogram, which revealed inflammation in his heart muscle, a clear sign of myocarditis. "I was shocked," Dr. Van Tulleken said in an interview. "I'm a doctor, and I knew about the potential cardiac complications of COVID-19, but I never thought it would happen to me. I was young, healthy, and fit." Dr. Van Tulleken's case highlights the unpredictable nature of COVID-19 and its potential to cause long-term health problems, even in individuals who experience mild initial infections. Dr. Van Tulleken's story serves as a powerful reminder that COVID-19 is not a simple virus. It's a complex disease that can have far-reaching consequences for our health, even long after the initial infection has cleared. His experience underscores the importance of seeking prompt medical attention if you experience any unusual symptoms after recovering from COVID-19, especially chest pain, shortness of breath, or heart palpitations. Early detection and treatment are crucial to managing potential complications and protecting your long-term heart health. Section 4. Decoding the connection, how COVID-19 attacks the heart. Scientists are still unraveling the complex mechanisms through which COVID-19 affects the heart. However, research has identified several key pathways that contribute to the virus's cardiovascular impact. Firstly, direct viral invasion. The virus that causes COVID-19, SARS-CoV-2, can directly infect heart muscle cells. This infection can lead to inflammation, cell death, and impaired heart function. While direct viral invasion of the heart is not as common as other mechanisms, it can have severe consequences. Secondly, the inflammatory response. One of the body's natural defenses against infection is inflammation. However, in some cases, the immune system's response to COVID-19 can become excessive, leading to a cytokine storm. This out-of-control inflammatory response can damage the heart, blood vessels, and other organs. Thirdly, blood clot formation. COVID-19 increases the risk of blood clot formation, a process known as thrombosis. These clots can travel to the heart, lungs, or brain, causing heart attacks, strokes, or pulmonary embolisms. The virus's impact on the lining of blood vessels and its ability to trigger an overactive immune response contribute to this increased clotting risk. Lastly, endothelial dysfunction. The endothelium is the thin layer of cells that lines the inside of blood vessels. COVID-19 can damage the endothelium, impairing its ability to regulate blood flow and blood pressure. This dysfunction can contribute to heart attacks, strokes, and other cardiovascular problems. Understanding these mechanisms is crucial to developing effective treatments and preventive measures for COVID-19 related heart problems. Researchers are actively investigating various therapies, including anti-inflammatory drugs, anticoagulants or blood thinners, and antiviral medications, to combat the virus's impact on the cardiovascular system. Section 5. Blood types and COVID-19. Unraveling the mystery. Emerging research suggests that blood type might play a role in an individual's susceptibility to COVID-19 and its associated complications, including heart problems. Studies have shown a potential link between certain blood types and the severity of COVID-19 infection, with some blood types appearing to be more vulnerable to severe illness. One study published in the journal Blood Advances found that people with blood type A may be at higher risk of developing severe COVID-19, including respiratory failure and blood clotting complications, compared to those with other blood types. Conversely, the study found that individuals with blood type O might have a lower risk of severe illness and hospitalization due to COVID-19. While these findings are intriguing, it's important to note that more research is needed to fully understand the relationship between blood type and COVID-19 severity. The exact mechanisms by which blood type might influence COVID-19 susceptibility remain unclear, but scientists are exploring several possibilities, including differences in blood clotting factors and immune responses among different blood types. It's crucial to emphasize that blood type is just one of many factors that can influence an individual's risk of developing severe COVID-19. Age, underlying health conditions, vaccination status, and other individual factors also play significant roles. Regardless of blood type, it's essential for everyone to take preventive measures, such as getting vaccinated, wearing masks, and practicing social distancing to protect themselves and others from COVID-19.